Welcome back. Hopefully you enjoyed your cup of coffee and also the beautiful scenery images from Oulu provided by Elisa 5G Stream. Now, the study visits will be continuing and we will be welcoming here OuluHealth, which is one of the innovation ecosystems of Oulu Innovation Alliance. And joining me on the stage are Minna Komu, Network Director from OuluHealth. Welcome, Minna.
Thank you.
And Timo Ala-Läkkölä, Project Manager from the Oulu University Hospital. Welcome, Timo.
Thank you.
And Minna, I'll be giving the floor to you first.
Thank you, Simo. It is my great pleasure to introduce you to OuluHealth ecosystem. Oulu, in the next slide, I will first introduce you to Oulu Innovation Alliance. And this collaboration agreement is giving the cornerstone for OuluHealth work as well. OuluHealth is a multi-stakeholder ecosystem. There are research institutes in our area, like University of Applied Sciences, VTT, that is State-Owned Research Center, and CHT, that is a Center for Health and Technology as a part of the medical faculty. We have a special healthcare by Oulu University Hospital, Oulu City's health and social care services, as well as we incorporate more and more citizens also in our work. Then the companies. We have a great number of companies in our area, and all who have their registered headquarters in Oulu are welcome to be part of our ecosystem. And then also here in Business Oulu, we provide the business development support for the companies. You can say that OuluHealth ecosystem can be divided into three different segments. One is the research and innovation. Then we have a health and social care service providers and testing environments, as well as the health and life science companies. Each of these segments have their own responsible person, and my role as a network director is to get this amazing orchestra to play together well. I wanted to highlight you also the vast number of health and life science companies we have in our area. Our core competence lies in digital health, where we can say that we are the global forerunners. But our companies are not only limited to digital health, but they are spanning over the whole cycle of health and life science companies, and anything from startups to growth companies and big companies as well. Today you have a pleasure to hear a bit more about a couple of the companies later on. With these words, I would like to say that here in Oulu, we create the future of the global healthcare. We love to do that in collaboration, nationally and internationally, hopefully with you too later on. Thank you.
Thank you, Minna Komu, Network Director of OuluHealth, and we'll be discussing OuluHealth in more detail in a bit. And if you have any questions, remember to send them on the Deal Room platform. But now it is my pleasure to welcome Timo Ala-Läkkölä. And Timo, isn't it so that we'll be seeing a video first?
Yeah, we are now moving on to OuluHealth Labs, and we have a short video to present our action, and then I will give further details what we do at Oulu.
Let's roll the tape. Before Timo continues, I just want to say that we visited the test lab in the introduction video yesterday, so the viewers, I think they are eager to hear more about this really futuristic environment. So Timo, the floor is yours. Enlighten us.
All right, thank you. These OuluHealth labs actually started from the need of medtech companies. In the past, when working in the development projects in social and health processes, we heard companies many times saying that it's challenging to reach out to real users to ask their opinion of the product that is under development. And at the same time, our professionals were saying that the devices are not usable, and like some engineers have made these without asking the real users. And we heard this message several times, and we thought, what if there would be a testing and development environment available for companies with easy access and affordable priced service catalog to cover the tests from homes to hospitals. And that would also help to get a better understanding of the upcoming products for professionals and get better products to use. And so we decided to establish OuluHealth Labs. OuluHealth Labs is a testing and development platform for companies to test and develop their health and welfare products and services in authentic healthcare environment with genuine users. Our platform covers the whole chain of healthcare and social care from the specialized level in a university hospital to basic level healthcare and students as future professionals. We have testing, you could change the slide now. We have a testing laboratory space in Oulu University Hospital called OUS Test Lab. Then we have simulation laboratories in Oulu University of Applied Sciences, and we can also utilize the healthcare centers and social services of city of Oulu, even people's homes as a testing platform. We are providing testing services for every phase of the R&D process. From idea to prototype phase to event-ready products where we can utilize these spaces as a training environments. Our specialty is a digital testing platform, sandboxed platform, where we can replicate hospital system interfaces for testing purposes. That is quite unique in Finland, maybe quite unique in Europe. Our doors are always open to test new ideas. We have actually renewed the innovation process of the hospital district, and now we are collecting ideas from our employees, but also from citizens to electronic idea management platform. When we started this a couple of years ago, by now we have already collected more than 1,000 ideas. These ideas are evaluated and processed regularly, and we always provide feedback for the person behind the idea. I must say that this has really been a successful case. And we also have created new model for public-private co-creation. The development is funded by EU Commission, and co-creation is really gaining momentum throughout EU as we speak. And now we would have a video for this in-demand co-creation model that we could show to you.
Do you want to boost digital transformation in healthcare? Are you longing for using your funds in a more efficient way? We have what you need. Welcome to the in-demand model. At in-demand, we apply two approaches at the same time: demand-driven and co-creation. First, healthcare organizations detect and tell the market what problems they need to solve. Then, a call for companies is launched looking only for the best providers to solve the problem detected. These selected companies receive funding to co-create, hand by hand with healthcare professionals, the final digital solution. They also get business support to boost their success in the market. The result, we have increased the capacity of health entities to systematically identify and solve their needs, while creating opportunities for private companies. During the project, digital solutions have been co-created in Murcia, Oulu, and Paris. What are the main benefits of the in-demand model? 1. Healthcare professionals are now taking the lead. They feel more motivated to innovate. Healthcare organizations are learning how to systematically identify their unmet needs. 3. European regions are improving their company's competitiveness. 4. Founders have now new ways to be more efficient through the use of public procurement. 5. Companies find an open door to develop digital solutions side by side with their client, increasing their future success rate in the market. For all this outcome, we believe in-demand is an innovative model that works when promoting innovation. Besides, in-demand is a replicable model. The project has already been tested in 3 pilot regions, Murcia, Oulu, and Paris, with very positive outcomes. Moreover, another 12 European regions have joined and are currently implementing the model. Together, we will form the in-demand community. If you're interested in boosting digital transformation and in finding new ways of innovation procurement, visit our website indemandhealth.eu.
And that was a brief introduction to OuluHealth Labs. Thank you.
Thank you, Timo Alalakila, Project Manager at the Oulu University Hospital. And now I want to bring you both for a bit of a discussion over here about this unique environment where you can conduct research, introduce innovations, develop businesses, and which also engages not only businesses, but citizens too. And since we are in a forum which talks about the role of cities in the innovation ecosystems, how has the role of the city of Oulu in OuluHealth been so far?
Yeah, so I can answer. So first of all, of course, now City of Oulu coordinates the OuluHealth network. City of Oulu was also the one giving sort of like the kickstart for the OuluHealth ecosystem. However, our role is not only limited to coordination, but also, for example, City of Oulu's health and social care services are a strong part of our ecosystem. And as Timo highlighted, just also Day's welfare service or Day welfare lab is part of the testing environments. In addition, I want to highlight that here in Business Oulu, we also provide strong support for the companies in Day's growth and internationalization, as well as generally in business development.
So it's really a community effort, you can definitely say.
Exactly.
And also what I think must be really interesting to the viewers is the model and ways of co-creation. It seems that you've been able to crack the code of effective and efficient co-creation, and it's a thing that characterizes Oulu ecosystem, the innovation ecosystem, but also OuluHealth. So could you tell us a bit more about this co-creation for the participants? What has happened? How does it work and so on?
Yeah, we have been working on the co-creation model development since maybe 10 years back already. Okay. So this really has been quite an effort. And in recent years, we have been able to get this model tighter and define ways how we can really collect the ideas and needs, like challenges from healthcare system and social care system, and then we can publish those ideas as a call for solution to companies in our region. Okay. And then we can select those best solution proposals from companies, and then the beauty of this model is that then we co-create the solution for the need, to fit the need, and then we get the problem solved, but also these ecosystem companies could get this solution as a product that they can sell also to other customers. So it's like a win-win-win model in short. And we have also utilized this OuluHealth ecosystem in this action, like we created a breastfeeding guidance pass, where we created the solution with the university hospital professionals, and we really tested it in the primary care of City of Oulu. So that's a quite good example of that.
It sounds like a Da Vinci piece of artwork of how you co-create. In a moment, we will be meeting two companies, Monidor and NE Device from Oulu. And as I've understood, they both been through OuluHealth ecosystem, the test lab. Do you want to share some information about the companies who went through your innovation ecosystem?
Sure, and of course these two companies now represent the large number or the vast number of companies we have in our ecosystem. But for example, Monidor company, they have been utilizing each and every one of our test environments in OuluHealth labs. So they are really a good example of that. How the testing environments can support the companies. And the NE Device has gone through this demand-driven co-innovation process and is a great example. What I want to add to this demand-driven co-innovation is that, of course, it is great for the healthcare professionals to get really solutions for this, answering this demand. But on the other hand, from the company side of view, it's really giving a very super solid cornerstone for the company, because if there is a need in Oulu University Hospital, there surely is a need elsewhere too. And what could be more better starting point for a company with a new innovation than to know that it is really a needed one. They just need to communicate and show the reference case from Oulu.
Sounds absolutely wonderful. And before we move into meeting the companies, Minna and Timo, what would be the kind of a greeting or a message that you would like to send to our viewers if they want to collaborate or maybe create the similar kind of environment in their own cities? What would you say to them?
I could answer to that. Our doors are open for great ideas. If you're looking for a platform to test your idea or prototype in real healthcare processes with real genuine users, so feel free to contact us, and let's continue discussions and find the right way to test your product in Oulu.
Exactly. We are known for being very open for collaboration, not only nationally, but also internationally. And we are truly always looking forward to establish new relationships. So on OuluHealth website, you can find our contact information. Please visit, please contact us. It would be a pleasure.
And it's been a pleasure of having you both here on the stage and sharing information about this wonderful innovation ecosystem. Timo Alaläkkylä, Minna Komu, thank you so much.
Thank you, Simo.
And now we will be moving to the company presentations, and we first see video from the company Monidor.
Working under pressure can lead to errors. Controlling accurate flow rate with roller clamp is difficult. These can increase risks. Our solution improves IV therapy accuracy, and remote monitoring reduces nurses' workload, especially at night. Quieter wards. More time for personalized care. Contact us for more information.
Hello and welcome. We are again here in the corridors of Business Asema and with Monidor and Mikko. Hello Mikko, wonderful to see you.
It is nice to see you. My name is Mikko Savola, CEO of Monidor, and I am happy to be here.
Could you tell us a bit more about what Monidor is? What do you do? What is the innovation behind Monidor?
Okay, that's wonderful. So Monidor helps hospitals to improve quality of care in infusion therapy and reduce workload of the nurses with remote monitoring. And we are one of the OuluHealth ecosystem company, and we have started in 2014. And we are one example how to create new innovation based on the real need and develop it together with hospitals.
Sounds absolutely wonderful. And here we see the product in action, right?
Yes, this is in action. So most of the infusion therapy is given gravity-based, so without any device. 70% roughly, and 30% is used with the pump. And our solution makes this more accurate and easy to follow. And we have a remote monitoring solution. This shows accurate flow rate and target values, and nurses can see multiple infusions from one screen at the mobile.
Okay, so you also have a mobile app that you can show the camera.
So
Okay.
here is our device running. So basically we started in 2014, and we have done close collaboration with Oulu University Hospital Test Lab and Kuopio University Hospital Living Lab. And it is very essential that we do from early stages close collaboration with hospitals.
And what this kind of an ecosystem and innovation environment collaboration, how has it helped Monitor?
It is mandatory. It is mandatory. So when we started 6 years ago, we have a medical doctor and also a group of experienced engineers who has a background in mobile technology and connectivity. But still we need to develop with small steps and test often to make it fit to the needs.
Exactly.
One good example is that we first want to tackle this inaccuracy problem of gravity-based therapy with device alone. And then we noticed that in hospitals, when it was used and CE marked and used, nurses need to follow maybe 10 patients at the time. So it's very easy to do it if they can follow it remotely, and they ask us to build it, and we decide to do that.
Okay, yeah, so technology is really helping your day-to-day work there. So I'm also thinking, are there still challenges that you need to solve? Because the journey sounds really positive and you've been able to test the product in a real environment, but what are you still looking forward to do?
Yeah, so of course, if we are developing to the hospitals new innovations, so typically it takes some time and process what hospital needs when they are deploying new technology takes time. So it can easily, even if we have a good innovation and can transparently show the benefits and it will pay off, it may take 1 to 3 years. So I would say that it would help a lot to the hospitals if they can make some kind of fast track for new digital innovation that really helps their daily life.
Okay. And if you were to, let's say, summarize the best benefits of working in an environment like OuluHealth and the Kuopio University Hospital, what has been the best benefit for Monitor? What have you learned?
People. So people who can help us, yes. So they have inspired us, give us ideas, and they are typically doctors and nurses, they are helpful. They want to make, if somebody is developing their daily life easier, they are happy to help. So I like people to work with, and we want to make something useful and helpful for them.
Sounds absolutely wonderful. Mikko Savola, as a parting message, what would you like to say to the participants of the Economic Development Forum? Maybe they are looking for collaboration or something else, but what would be your greeting to the viewers on the other side of the screen?
Okay, so we have developed this kind of nice and good solution for hospitals. So we would like to expand this technology and its use all over Europe. And we have a distribution partner network and we are happy to help. So if you want to hear more, please do not hesitate to contact us. My contact info can be found from deal flow and our website monitor.com. So I'm very happy to meet you all.
That's wonderful. And Mikko, we actually got a question on the chat for you. So Helen Mulder is asking, are there already connections with hospitals in the Netherlands with this innovation?
We have 2 hospitals in Netherlands using our solution, and actually they are using the device itself, and we are now, Corona has made some difficulties to go with new innovations to the hospitals, but we are planning to start maybe right after the corona pandemic restrictions, we can start building, use this new innovation in Netherlands too.
Use cases again. So Helen, the answer is definitely yes. And I think I can sense of some sort of a connection already made in here. So just as Mikko said, his information can be found on Deal Room platform on the exhibition site. So please do send questions, comments, or if you want to e-meet Mikko, please do that because it's possible. But right now, Mikko Savola, CEO of Monitor, thank you so much for joining us.
Thank you. It was very nice to meet you.
And good luck in all your endeavors in the future.
Thank you.
Thank you so much, Mikko. And now we will be moving on to our next company, who will be somewhere over here. Yes, let's see if I can find the right door. And you just follow me over here. Right. I think we have to knock. Hello, can we come in?
Sure, welcome.
Wonderful, thank you so much. So here we have Any Device and Laura.
Hello.
Nice to see you, nice to see you. We were just getting to know a Monitor, one Oulu-based healthcare company, and here we have another one, which is called Any Device, and you have a remote vital signs monitor. Could you introduce us for the participants of this conference and explain a bit more about what your product is all about?
Of course. So, hi everyone. My name is Laura Niemi. I'm responsible for marketing and brand identity at Any Device Software. I'm accompanied by our CTO, Miikka Kirveskoski, and our computer vision specialist, Henri Tikkala, who is acting as our test patient for the day. We're here demoing our solution, which is VitaCam. It's a remote vital signs measuring device that essentially combines regular digital cameras and computer vision to measure a patient for their vital signs.
And am I right in assuming that this is the product working right there in the background?
Yes. So on the left side you can see heart rate measurements, and on the right side respiratory rate measurements, and they keep updating on the screen every 15 seconds. And as you can see, masks are not causing any issue. We're able to measure Henka just fine. This is our emergency room setup, which is mainly for hospital use, but we also have a mobile application, which Miikka can show a little bit. So this one also combines some additional features, and it's intended mainly for at-home use and care home use.
It's an absolutely fascinating idea. Corona stands nothing against it, as you already said. How does someone come up with an idea like this? Did you come up on this on your own?
No, this is very much a product of co-creation. We started development on this solution in 2019. We took part in a challenge called In Demand, which you may have heard about. It's an EU-wide challenge, and it was backed by the city of Oulu. And we were one of the winners of this challenge. And ever since, we've been working with the university, or the Oulu University Hospital, sorry. And we've been taking advantage of their test lab environment and other resources ever since. The challenge itself was concluded last year, but we still continue working with them actively. We even have an active pilot in the emergency department.
Sounds absolutely wonderful, and it's a great concrete example of how co-creation then turns into a company. Miikka, how has this experience been for you so far?
It has been really great. So basically we have been receiving plenty of support on different channels. So basically there's, for example, the funding from the city of Oulu. Then we have Business Oulu. They have been helping us with the business plans and go-to-market planning. And then we have OuluHealth, of course, so we are getting publicity like this. And in different venues, different events, social media and so on. So, this is all in addition, of course, to the excellent professional support what we get from the Oulu University Hospital. So that has been one of the key things to the success.
If I understood right, you have never had to be alone in different stages of your business.
That is so right. So we are all the time getting the support what we need. So it's excellent.
Sounds wonderful. Now that you've had a chance to experience this type of co-creation model firsthand, have you run into anything you think could still be improved upon?
Yeah, well, basically when a company like us, for example, enters in an area which is kind of a new, so health tech and medicine technology, that is really a tough area. And we have had a lot of questions on this area. What could improve perhaps in the start to be able to ask the right questions would be that if there's some kind of a structured summary about hospital regulations, technical standards, that sort of things.
Mm-hmm. The bureaucracy.
Exactly. But apart from that, it has been really a good experience. So we have been getting the excellent support from the Oulu University Hospital. So a lot of brainstorming sessions, how to do things best. And also there's, we have had the opportunity to do this in a kind of real world environment. So that has been really crucial for something like this. And that's also enabling us to gather the clinical data what we require for the certification process.
And as I gather, there seems to be this kind of an open dialogue going on. And do you brainstorm a lot with the other actors in the environment?
Absolutely. So it has been, that is the way that we are developing the product. So it cannot be only the engineers making the decisions, because otherwise we will miss the hospital aspect of the product.
Exactly. So what does future hold for any device?
Right now we are aiming to enter the market during this year, so CE certification and also getting further funding for the product.
Okay, so a lot of quick developments going to happen. I just want to check up with Henry. All right, you've been a great test subject over there. You can definitely relax and breathe over there. All good?
Yeah.
Wonderful. How has it been? How has the experience been for you?
It's been very fun and nice to be in part of this whole project.
Wonderful. The whole team is very much molded together. If I were to ask you to send a message to our viewers over there on the other side of the screen, maybe they want to collaborate or they want to learn more about you, what would you like to say to them?
Yeah, certainly. Get in touch if you are interested in, for example, partnership, cooperation, or perhaps piloting in your city. So we are really open to all the suggestions on that one. Thanks.
Wonderful. Anydevice.com is the website, and you can find their information on the Deal Room platform. They're one of the exhibitors over there, so do definitely get in contact with them. But thank you so much.
One thing perhaps still, that the product-specific website is vitacam.health. You can find it also in the
Deal Room platform.
Yes.
Wonderful. There's something, homework assignment for all of you viewers over there to do. But right now I would like to thank Laura, Miikka and Henry for this wonderful interview, and good luck in all your endeavors with any device.
Thank you.
Thanks.
Thank you so much. Whew, I am impressed. How about you? Send your comments and thoughts on the Deal Room platform again, and tell us what things inspired you the most. And do that with a warm cup of coffee or tea in your hands, because we'll be going into a little break right now, and we'll be back in 20 minutes. See you soon.